Good morning, everybody. Welcome to the 18,022nd meeting of the Maryland Lead Poisoning Prevention Commission, founded in 1994 by the Maryland Legislature. We are glad to have you with us this morning and glad to have folks in person. We're going to go through the fundamentals of attendance and minutes here for a second, but we do welcome anybody who non-commissioners are part of the public. We encourage you to raise issues, questions, or anything that you may have. And then next, this meeting, we will have a representative from the White House Environmental Justice Council to talk about efforts on lead safe service lines and other efforts. And also I've asked them, Ms. Adams, to present on work that's happening in Memphis, Tennessee on lead that has just been covered by the Washington Post and others. Really an exemplar of excellence in advocacy. So I look forward to her arrival and presentation. But first, let's say good morning, and just for those present, let's get on the record who's here.
Paula Montgomery, Commission member representing Maryland Department of the Environment. Good morning, everyone.
Oh, we got a little bit of a echo.
Yeah, I'm taking care of it.
Okay.
Give me a second. Okay.
Go ahead, Barbara.
Hi, I'm Barbara Moore, pediatric nurse practitioner, director of the lead poisoning program at Mount Washington Pediatric Hospital, commission member.
Hi, Theo Williams, DHCD Secretary's representative.
Great. And Theo, I'm going to ask you if you did the debrief in a few minutes from HUD. I don't know if you did.
Oh, no, I have an update on that pretty much.
Okay, great.
But yeah.
And Stephanie?
Stephanie Cobb Williams, Deputy Director, Land and Materials Administration here at the Department of the Environment.
I'm Ruth Ann Norton, the President and CEO of the Green and Healthy Homes Initiative and current chair of the commission. That applause is not for the people in the room, or is for the people in the room, not for me. Others on the line, Susan, you want to start first? I see you.
Yep, thanks, Ruth Ann. Good morning, everybody. Susan Kleinhammer, Lead Tech Services, commission member.
Okay, I think is Cliff. There he is, Dr. Mitchell. You almost look like you're in a white doctor's coat. Are you, or just in spring attire?
I am in spring attire. Thank you. I have a white doctor's coat, and I refuse to wear it on the grounds that it might incriminate me.
Okay.
Clifford Mitchell, Maryland Department of Health commission member. Apologies that I can't join you in person, but I had a meeting here at the department immediately prior to this one.
No worries, no worries. Who else do we have? Wendy?
Adam, you're muted. But I know Adam's here. He might have stepped away for a minute.
Okay. Benita?
Yeah.
Good morning, Benita Cooper with the Maryland Insurance Administration, commission member.
Okay. Wendy, you'll have to scroll down there. I don't.
Okay. So we have Adam, Anna Davis is on, Barbara Moore, Benita Cooper, Cliff Mitchell, Mangela Paul. You want to introduce yourself?
Yes. Good morning, everyone. I am Angela Paul, nurse consultant for the Office of Child Care at the Maryland State Department of Education, commission member.
Okay. And Paul Rogers?
Yeah, good morning from the Eastern Shore. Represent the Maryland chapter, American Academy of Pediatrics.
Fantastic. Great.
I think that's everybody. Anna, did you introduce yourself? You're muted, by the way.
I didn't. Hi, good morning.
Wendy,
Anna
it's
Davis,
Adam.
commission
I'm
member.
back.
Okay.
Sorry about that.
Okay, it looks like we have quorum, and Anna, good morning. I think she's trying to introduce herself.
Yes, good morning. Good morning, I'm here.
Fantastic.
And then there is somebody on the phone. It's the last two digits is 61. I'm not sure if that's a commission member or not, but if you cannot.
This is Catherine Baltimore. I'm having connectivity issues. I call it.
I'm sorry, is Catherine, did you say Catherine?
Yes, Catherine Taylor.
Oh, Catherine Taylor. Okay. Thanks for joining us.
And I think Nicole Hart is here, who's pending appointment. The first thing I would like to do is let's get the approval of the minutes from April 24. Like, so if you want to put the minutes up. Don't worry about it. There isn't one. Oh, okay. So did anyone have a chance to read the minutes? And if you have read them, any comments or questions or emendations to the minutes? All right, I hope everybody read all those links that were in the minutes, and assuming you did, I'm going to test your knowledge later in the meeting. Can I get a motion to approve the minutes?
I'll make a motion.
All right, second.
Second.
Got it. Thank you. So Paula Veltri made a motion. Dr. Mitchell, I'm getting used to it. Dr. Mitchell, second. All in favor?
Aye.
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 All opposed? Okay, that's great. We will wait for Ms. Adams is in traffic, and I know traffic, I have to say, for everybody is getting worse, and we're feeling the impacts of not only the missing part of the Beltway that was the Francis Scott Key Bridge, but I don't know where all the people in the world came. I was in the airport coming back from Detroit, and I thought, wow, I've never seen it so busy in my life. So who knows where everyone came from. Anyhow, a couple of things I wanted to bring up if we could. I'm going to actually start from the bottom of this and move up. Dr. Mitchell, on the blood lead reference level, do you have an update on that?
My update on the blood lead reference value is that we are continuing to work with GHHI on revising a public for the clinical community, clinical practice guideline to go out just to reinforce what we have been saying since 2022, which is 3.5 is the clinical value that the CDC and Maryland have adopted legally with the change in the law that took effect in January of this year. We've seen additional people calling, including physicians' offices, and Dr. Nancy Servetus is continuing to field calls from physician offices and elsewhere about what to do about children with blood lead of 3.5 or greater. So there's still some confusion and need for education in the clinical community, but we're continuing to work with both local health departments, clinical providers, and doing other outreach with GHHI and others to make people aware clinically of the importance of following up with children with a blood lead level of 3.5, and continuing to work very closely with MDE on how to make sure that providers are getting the information on their testing requisitions necessary to be able to take action on those.
So let me volunteer. Oh, sorry, go ahead. Somebody was about to say something. I thought. Let me volunteer, Cliff. In June and July, not the height of time for people to always be present, but I will be I'm doing a 30 township tour of the Region 3, but 10 of those towns are in Maryland at the start of this. So if I can do anything to help do outreach on this work to community organizations, health organizations, and counties, I'll share the locations with you with that, and certainly want to do that. And I would say that to any of the state agencies on lead, if there's things or grants that you have out of DHCD, we're going to do a bit of a pop-up. Part of it is to also roll out the Thriving Communities grants. But I want to use the opportunity while there to get real community engagement and action around all the things that we need to get to people to be proactive, whether it's their lead service lines that they need to learn how to check, et cetera. We're also going to be taking on 5 student service volunteers from the state, from the Governor's Office of Service, to work on climate and lead. And kind of, so if there are things that we need to get to community, we will have these 5 student service volunteers for a year, supported by the state of Maryland, and we want them to help us do the community engagement, getting people monies that they need, whether it's driving rebates, getting them signed up for earned income tax credits as well, getting information in their hands about notice of tenants' rights, grants that come out of DHCD or the federal government. We're going to try to equip people with usable packets of information to engage throughout the state. Because, you know, often out, you know, in Baltimore, we have a lot of resources, and often outside of the state, people don't connect to those resources. So especially in Western Maryland and the lower Eastern Shore, we're going to be concentrating a lot of efforts. This is one that if we have a education deck, we want to get people up to speed to what it means for getting their kids tested and what a lower level may mean. Any questions for Dr. Mitchell on this? Yes, Dr. Rogers.
Yeah, just one question, Cliff. I don't know if there's anything we can do through the Maryland chapter of Academy of Pediatrics. We have emails to everybody in the state. If you want to put something together, or me put something together and send it out to everybody, I just would throw out the question what we can do to help out.
Paul, I really appreciate that, and your time is coming. I think what we want to do is when we get the revised clinical guidelines printed and ready to go in electronic form, that's when I think we'll probably ask you to do a direct pitch to the members and pediatricians and nurse practitioners.
Great. Do you have an estimated time?
It's going to be at some, my best estimated time is it's probably going to be a couple of months, because we've got some heavy activity on asthma that's taking place over the next several weeks. So I think once that's done, we're going to turn our efforts, and this is for Wes's benefit, we'll turn our efforts to the clinical guidelines, because it's one of the things we do want to make sure we get done fairly quickly.
Sounds good. In the meantime, I can send out just an alert, you know, to everybody that there's been some changes, and
I'm happy to work with you on
coming. There'll be more specific coming. Okay, great.
Yeah, no, and I think that, and I saw that Fred Banks is on, but I think that one of the things we absolutely want to do is couple the clinical practice guidelines with what I hope will be, with MDE's assistance, a scorecard on which items on the blood lead testing requisitions are most often not filled out correctly. And Fred, I think if we can actually develop a kind of a quick infographic which shows which blood lead test requirements are most often missed, I think that will help the pediatricians, because I think they will look for those.
Yeah, Dr. Banks, are you there? Would you like to say anything?
Yeah, so we collect that data, and Shamola Dye, our epidemiologist, can give us a estimate of the percentage of missing information for each variable. So we can get that to you today or tomorrow, and that may help kind of drive the need to get that information filled out correctly. So
yeah, no, I think that would be great, Fred, and I think we can work with you and Shamola and Dr. Boss Victoria on a snazzy infographic, which our GHHI friends can help with.
And let's make sure that we are doing this in multiple languages. And I know so we'll want to tap maybe MDH's language services or others. To do that, you know, I don't know if anybody saw in the newspaper today that in Baltimore City, we have one of the highest rates in the state of Maryland, one of the highest rates of immigrant children in the country, influx of immigrant children in the country. And so we need to pay attention to the language barriers that will come with that, how we're approaching our outreach on that for certain. So appreciate that. And Cliff, I know we talk about this later, but you have a May 7th asthma summit at Bowie State University, and I know you've been doing a ton of hard work on that. So all who can attend and support that or are interested in that intersection of healthy housing with asthma should attend. I didn't know if you want to say anything while you have an opportunity before we turn our attention to other matters.
No, I think you said it very well. The only thing I would add, and I'm guessing that either Wes or I could put the link in the chat for people to the Eventbrite reservation.
Wes or Angela.
Yeah.
Anybody, right? That'd be great.
But I think that just to say, we are as much as possible trying to link and talk about healthy housing as a whole. This is an effort that we continue to do. I think that you're likely to hear sometime very soon about other work the federal government is doing on healthy housing. This is simply to acknowledge that as we talk about asthma, we continue to talk about lead and radon and other housing related environmental concerns, where addressing housing as a whole is the best way of essentially improving population health across the state.
Fantastic. So if Angela or Wes are online, I see Angela, I can't see below, but please put that, or maybe it is in the chat. We just can't see the chat here. If I could, Wendy, I'd like to turn attention to our special beloved guest and my friend, Latricia Adams, who not only chairs the commission for Memphis Shelby County, where we have a couple of GHHIers on the ground in support, but Latricia is here this morning. She is the founder of the Black Millennials for Flint that has recently changed its name to Young, Gifted, and Green, probably one of the most effective organizations and advocacy on the ground throughout the country on lead poisoning prevention, healthy housing, and I think all things environmental justice. And Latricia is a member of the White House Council on Environmental Justice, an educator by profession, and the single best human being that I know, and a good friend. And Latricia has some slides, Wendy, if you would bring them up, and to acquaint us with her work, especially around lead service lines and particular work here in Maryland. So welcome, my friend, to Baltimore, and welcome where I know you're here often and your presence is here often, but you are here with the members of the Maryland Lead Poisoning Prevention Commission, which was established in 1994 by the state legislature and is hosted by the Maryland Department of the Environment.
If I ever need a hype person in my life, you always have the job. Well, thank you so much for welcoming me into this space. Before I get started, I wanted to give you all kudos and a shout out. With the commission that we have in Shelby County, which is this Memphis, it's what we're most known for to connect with, was actually modeled after this state model. Wow. So when we previously the state senator, who is now the mayor of Shelby County, Lee Harris, he passed a bill in 2018 that was a bipartisan bill, which is in Tennessee is different than Maryland, but it called for mandatory testing in school drinking water. And so Rudan and I had worked some years back around some amendments to that bill. And so we were like, if we can get something like this to happen in Tennessee, why don't we take it a step further? So I wanted to acknowledge you all that literally we used your model and pitched it locally. Hopefully one day it'll be statewide. We'll see in Tennessee, but wanted to frame that and say thank you for your existence, where you're doing great work to inform Maryland, but it definitely has an impact nationally as well. So wanted to start with that. So I can go to the next slide because I can't control that. I was about to move this.
Yeah, there you go.
So what I wanted to
Can you back up and take 2 seconds to say a word about Young Gifted and Green before you jump in, please?
So with Young Gifted and Green, our work actually started with on the East Coast. So it started in the wake of the Flint water crisis. So we actually founded everything in Washington, D.C. So if you can go 10 years back, because that's how long it's been since the Flint water crisis. I know. Last Thursday marked 10 years from the switch from the Detroit water system to the Flint River. There was a lot of work going on with Congress to get immediate funds to Flint, Michigan at the end of the Obama administration. And so while there was work done on the ground with community organizers, we did a significant amount of work on the Hill to get it to the finish line, to get those emergency funds. But then it also incorporated a lot of direct resources at that time where it's been a journey within a decade around the crisis. And so what we learned early, we were young, we were millennials, we were the youngest at that time, but not now. We're still young, you know, but we have another onset of younger people who are in this work. But essentially, we realized very quickly that issues surrounding lead were not just pervasive in Flint, Michigan, particularly around water infrastructure, but literally cities that have a similar dynamic, right, demographic. And so maybe 3 weeks after we did our first big weekend of service in Flint, we came back to DC because we brought youth with us. And we learned that there was lead in their school drinking water. The very same children that had met with the children in Flint had the same issues. So I was pretty upset about what was going on with Flint, and then just connecting the dots with lead just being an issue pretty much in almost every Black and brown city across the country. And so with that work, we started with Thursday Network with the Greater Washington Urban League, which is an affiliate chapter of the National Urban League. We also partner with the Greater Baltimore Urban League Young Professionals as well. And so we were like, if there are lead issues that are happening in Flint and DC and all of these other majority Black cities, let's take a look at Baltimore. And so at that time, the president of the Greater Baltimore Urban League Young Professionals, I know that's a mouthful, educated us about his own experience because he's a Baltimore native about lead paint. And so we, were blown away, even though we're literally right here, like in the DC area, we're blown away that like, wow, this is really a large issue. And so we hit the ground running. And so kind of the lead into this slide to get you to how we got connected with Baltimore. The very first grant that we received, because everything was we were volunteers, we were young and poor, everything was volunteer based. So we met Ruth Ann. We went out on a limb. We didn't have a 501c3 at that time. We leaned on the Urban League to say, hey, trust us. I know we're young, but we promise we're going to do good work. And so we submitted our first grant and got the first grant through the Green and Healthy Homes Initiative. And with that funding, we did two things that are still standing today that I'll talk about. Is we started a community leadership development program that's grounded in EJ called the Lead Prevention Ambassador Program that literally is written verbatim in the application that we submitted, 2017, 2016? Okay. And we still have that program today. We are in our 7th cohort of those leaders. And so it has since expanded. Baltimore is one of those cities. And so we also still literally maintain the same programmatic model that we started almost 10 years ago. So we see here with one of our strategies, and that's one of the things that I hope to just kind of give you an overview of what we do. So one is our favorite, which is our door knocking campaign. So you'll see here to the right, So both Ruth Ann and I were featured in a documentary with BET some years back, pre-COVID, around that initiative, where essentially we marry two things. So we take the Baltimore lead paint violation report, which is awesome. Man, we wish that we had that in other parts of the country. But we take that, we look at the list, and we actually go to those homes. One, to see if it's anybody there, because a lot of times they're vacant. And then two, if it is somewhere there, essentially we give them information around what their rights are to ensure that they get the remediation that they're supposed to get, because these are renters, right? Which you know that is a bit much to navigate. So we started this model in Baltimore in partnership with the Green and Healthy Homes Initiative, but also with the Baltimore Health Department, which you'll see that's a recurring theme here shortly. And so initially pre-COVID, and we're trying to build this back up, but it was very effective, where we literally went address to address, block to block, to inform people that, like, did you know that your residence is on the violation list? A lot of times they didn't know, because in a lot of these communities it's highly transient. It's difficult to make sure that that kind of knowledge is transferred from tenant to tenant. Also in this door knocking campaign, we try to get the biggest bang for our buck, right? So we also talk about the services that are provided through the Baltimore City Health Department Childhood Lead Poisoning Program. So we really hit it hard around blood lead level testing. To date, we've very much refined that process, where and we actually learned this from Memphis, specifically around looking for clues to see if children frequent a home. At first, we would just do a straight ask, like, does a child live here, 6 and under? And so we thought that that was brilliant. And then why we made that connection before, like, oh, you could still go to someone's house and not live there. I think about myself as a child. I went to my grandmother's house almost every day. And so incorporated that into this model so that we can circle back and ensure that that particular home, if they do have a child that lives there, frequents there, has access to information about blood level testing. We work with Camille. Camille gives us a ton of resources that we can give directly to those individuals with consent. And then also it gives us information that we then build into what we see to the left, which is an audit report. If you look at the list there, you'll see that this report was actually generated by our lead prevention ambassadors. So these are community members. This is not, like a firm that we hired to do the support. It's literally community members that essentially took the list and assessed if homes are actually coming into compliance and falling off of the list. And they are. So the first reiteration we did was in 2019. So we kind of do like 2 years in between. And we are seeing that addresses are falling off of that list. That's a big win. But then also it feels good to community members to see that, like, this process that's in place, especially with it being led by government, like it's working and we're all on the same page. So that's one of our strategies that we use, is with the door knocking campaign.
Can I
Sure,
pause there? And
sure.
I know you've got a lot to talk about that's important. But it seems to me for like MDE, is there value in MDE and also supporting teaming up? I mean, I don't want to mess up the magic or anything, but you've got so much information to do and around housing units that you're looking at. Just making sure that if this is coordinated with the health department, are you getting the information you need on, like, grants through the housing department and others to give to families and owners? Is there MDE maybe support that on outreach here, or even Cliff, I'm thinking about, as this may continue, state support? I just think this is, at some degree, good old fashioned outreach, organizing work that we all know is successful. It's human connection, right? I want to just praise on that. And it is actually bringing to life what a lead violation report is, and people don't know that their homes are on the city violation list. So that awareness is, like, amazing. Dr. Mitchell?
Yeah, thanks, Ruth Ann, and I really appreciate this. I think that our local health departments are where the sort of boots are on the ground from a people to people part. And I was going to ask whether or not there had been any interaction with the local health department up to this point, because I think that's generally speaking at the state, we encourage people to interact with, and our local health departments have a lot of interaction with community-based organizations and groups already. So I didn't know whether or not there was already with Baltimore City and Baltimore County any interaction.
Yeah, it sounds like Camille's just been a superstar.
She's been a superstar. So we work very closely with the Baltimore City Health Department, or I know her role has changed with Camille.
Yeah.
I know. But still very much so work closely with the health department. Even and we'll see in a couple of slides, you'll actually see Camille. We do another project where we go into beauty salons and barbershops. Where essentially we talk about lead. We talk about lead, how it impacts public health. And so Camille literally will come out like and actually speak to community members like when we are in those environments. So I would say that we are, at least in Baltimore City, I don't want to misspeak for the county, but in the city are working very closely with the health department, and it's mutually beneficial. So they get excited that we're using and looking at the violation list because they have staff that's populating that. So it is mutually beneficial for everyone, right?
And I admit I've heard about it, and Camille and I have talked about it. So I was asking because I think people should know about, the work that you're doing.
Yeah, and we should all support it. Nicole, is Deputy Commissioner of Baltimore City Department of Health. You are on mute, my friend.
Oh, no.
Hang tight. We want to hear you.
I hate when that happens.
I know. I am so just blown away by what you're doing. I really, truly am.
And I know you have more slides to get to.
Yeah.
If we can give Camille Nicole 1 second.
Yeah, no problem.
Nicole, if you want to call in on your cell phone, you can do that, and then we'd be able to hear you.
Okay. So we're going to go to the next slide, and then when you're on, just speak up, Nicole. Okay. Unless she's all right. There you go. Give me a few minutes. You got it. All right. Let's go to the next slide there.
So perfect segue with Shop Talks. So essentially what Shop Talks look like, we partner with local Black-owned barbershops, and we talk about lead. We talk about other aspects of environment too. I know a big topic that garners a lot of attention is we talk about the intersection of lead poisoning and male reproductive health. I think why that's really important is because when we talk about lead poisoning, we usually talk about women, childbirthing people, and children, but lead is not good for any human being. And then also it allows us opportunities to bring in resources. So I know this past summer, for example, we got at random, like about 100 donations from Zero Water for Zero Water pitchers. And so it's a good segue because we know that right now in Baltimore, they're doing the lead service line inventory, where it did bring some preliminary awareness around lead and water, or potentially lead and water, which was good. But essentially with establishing these types of partnerships, one, we become familiar because it's with barbershops is so intimate, it's close-knit, and it allows folks to ask questions in a safe space. We also bring Camille on the road with these shop talks as well. Really, it really helps. The Baltimore Health Department has so many resources. I brag to Camille all the time. Like, this does not happen all the time in some other places where we work. But this is ongoing. Also, we essentially try to make information that is really technical around lead and other environmental justice issues more tangible and accessible to folks. And we literally can see, like, we've had, I remember in one shop talk that we had in Baltimore, and this is at Presentable Cuts, by the way, in this photo, we literally had someone to call somebody on the phone and say, hey, can you go into the barber shop? Because you need to hear this. So that's one of the models that we use as well. If we can go to the next slide, because this is somewhat aligned. So we have an programming umbrella called the Black and Brown Alliance. With the Black and Brown Alliance, we focus in general on the intersection of environmental justice and maternal health and reproductive health. And so similarly to when we go into barbershops, we also go into beauty salons. So in this photo, you see the lovely Camille in the middle here, but this was at the River Ocean. And so essentially similar to what we do in a shop talk, this is a little bit different and a bit more nuanced. So in the beauty salon talks, we specifically talk about the impact of lead poisoning prevention and maternal health. So this young lady that you see in the pink, she is the executive director for an organization called Mom Cares Baltimore, which they provide doula services. So we've been working with her for about 5 years. And what we do there is with her doulas, she now has a whole staff of doulas. We try to incorporate into the preventative care model lead poison prevention. So we encourage them to share with their clients, like, you should get tested. When baby gets here, they should get tested. If you already have children, they should get tested as well. And then there's also other resources that's connected to housing that Camille is able to bring in. Great. We're also able to do referrals as well. And so with these environments, similar to the barbershop, it's small. So it's not like you have like 100 people at once, but it's more intimate. We also bring in public health people. So the young lady with the green vest on, she's a public health researcher at Johns Hopkins. And then the young lady that is to the left of her is actually one of our co-founders. But she's also a public health PhD candidate at Johns Hopkins as well. So we try to make it a diverse representation. We try to ensure that it's culturally relevant. As you see, this is a whole team of Black women in a Black beauty salon that is trying to essentially bridge the gap, making a connection between environmental health, reproductive health, and maternal health.
And the Black Mental Health Alliance, which is headed by Andrea Brown, a GHHI alum, but they want to connect more on the ground about EJ. So I think it's a perfect fit here. And I'm also thinking Barbara Moore is with Mount Washington Pediatric Hospital. This connection with the doulas, I think, making sure that you guys are connected on those resources, really great. Do we have Nicole Hart?
You do have Nicole Hart.
Yay!
So wonderful information being shared. I am quite sure that we get the referrals on the back end from the health department. I am speaking for Kat that if she is not already involved and we are not already directly involved with you, that we would love to connect. But to some of your points that you raised in your previous slide, in addressing the lead in the water, I just wanted to let everybody on the call know that DHCD is in talks with DPW on how we can assist homeowners with addressing that particular issue from where DPW side ends to where it becomes the homeowner's responsibility. So those talks have just started to happen. So if there is any information or insight that you all would like to send me just to be considered on how DHCD addresses being able to assist homeowners with that issue, please let us know. Also, what I wanted to lift up is that we have a ton of palm cards and door hangers that we would love to share with you in your outreach for our services that you can come pick up right now. So feel free to connect with me after this meeting and we can make that happen for you. Thank you.
Thank you.
And Nicole and Latricia too, I mentioned maybe before you were in the room, but we are getting 5 service volunteers as part of Governor Moore's state
good.
service volunteer program. We're going to host at GHHI. We'll expand that if we can. But I would love to have them support you on this issue of the lead service lines. We are getting so many calls of people who just, they're either older, they're disabled, or they are not educated about their own home as a homeowner, hasn't received the kind of education to know how to track what a water service line is or how to go into a crawl space. I would have to say I'm one of those people who wouldn't know. If you set me in a crawl space, I'd be looking for rats or something, and not my service line, who are just scared to do it, right? So I'd love to build as much inertia around that and have the state service volunteers support the efforts when you're doing this as well.
Yeah, that's wonderful.
Yeah. All right. Let's keep going. And that is wonderful. And I love the connection with the duelists. That just, yeah, it's amazing.
We can go to the next slide, and I think I'll be wrapping up. Yep. So essentially, just to kind of round us off. So I didn't go into great detail with our lead prevention ambassador program, but I think like it kind of speaks for itself. So the people that you saw in the images, those are our ambassadors. So essentially with the lead prevention ambassador program, it's 12 months. It is very robust and comprehensive, not just around lead, but it also incorporates other aspects of environmental justice. So like, for example, climate, as we think about extreme weather and how that, directly impacts communities. We also talk about other pollutants. Of course, we talk about housing, very often talking about housing. But one of the biggest things around the Lead Prevention Ambassador Program is we try to build capacity for community members to be advocates and really lean into self-resiliency and self-determination. So it's really been magical to kind of see community members leading this work where you don't necessarily just see me doing it, but actually like people who are in community, especially those people who are directly impacted by some of these issues, being the face of this work. And so essentially what our model is, so with the organization at large, we try to serve as a liaison or like a bridge builder between community and agencies. I know Ruth Ann mentioned earlier, I was an educator by trade, but I worked in a district level. So I worked in government for like a decade, for like 10 years. So I understand the dynamic between community and government. We know that sometimes that can be prickly. And so we work really diligently to try to be kind of like an intermediary to establish trust and rapport between community and community-based organizations, but also community members. And a lot of that is demonstrated in what we showed, where getting folks like out of like their offices and actually come on the ground and being like visible and not being like, oh, siloed, like you stay over there, we stay over here, but really demonstrating like how powerful it is if everyone is working together and everything kind of coalesces. Then in addition to that, I think even, from a resources model, we have found this to be good, especially, in this current climate, with being able to demonstrate like this whole government approach where you're bringing in different agencies that are public servants at the end of the day. We want your work to shine and for it to actually meet and get to community is essentially the model that we uphold as an organization. But I said a lot. I tried to abbreviate it as much as possible because there's a lot of other things, but didn't want to take up too much time.
No, and I cannot tell you the number of people who have been associated with Black Millennials for Flint and Young, Gifted, and Green who are now in amazing positions.
Oh, yes.
Around the country, both the awardees that are lifted up every year, and those who have been involved in the engagement actions. And so I just think that's wonderful. Before we get to any questions or anybody who feels they have opportunities to support this great work, anything you want to tell us from the White House? It's been with you and Joe and Kamala hanging out all the time.
Yeah, so
I can only find Latricia now if I look at 1600 Pennsylvania Avenue.
Oh man, we were in New Orleans. I just got back last night. But what I will say on the resources side, I know that it's kind of overwhelming with the new grants that are coming out, but I would say please take advantage of those. And the other caveat to that is to make these large applications competitive. They are literally looking for a collective with government and CBOs. They are very adamant about that, which is a shift. Because some of the grants that have rolled out, they turned it on its head, where historically, a government entity would have to be the lead applicant, but now it's in the reverse, where you have organizations that now, can apply on their own, but there's still opportunities and should be for government to still show up in that. So we got, for example, we got Solar for All. We have the IRA climate change grant. That's I think the phase one, or not phase one, but one of the tracks is up to $20 million.
The community change.
Community change grants.
We're doing one here in
Okay,
Maryland.
good.
You should make sure that you're in it. But there is one going in around lead and healthy housing.
Yes, so we might not ever see these types of investments in our lifetime ever again. So that would be my biggest push. And then also what I would say is, I know that there are a significant amount of changes with rules. So I know, for example, with the lead and copper rule, I would say one of the things that we're also trying to work on is with the lead service line inventory. That's phase one, and being prepared for the next wave is with replacement. I will say, and this is respectfully, because Baltimore did a lot of work in the 80s on the public side, it's still a bit of a mammoth task to determine what exists on the private side. So I would say getting ahead of it from a public health perspective, around communication, because we're kind of seeing what Ruth Ann mentioned. People are really confused and get terrified, oh my God, I have lead in my water. You might not have lead in your water. We don't know. But I would say kind of getting ahead of that, especially as we anticipate these lead and copper rules to be finalized at least around October. We're going to say October. It might be November or probably October. But wanted to say that.
If I can add a little bit to that. I did an op-ed that came out a couple of days ago. I don't know Wendy shared it or not yet, with the Center for American Progress, that said we have to pay attention to lead service lines. We cannot bury our heads in the sand that lead-based paint is still the main pathway that we know of, along with other things like spices. And we have to look at that larger exposure issue. Tomorrow at GHHI, we're meeting with Climate United, the largest recipient of EPA funds for greenhouse gas emission dollars. And the part of the meeting tomorrow is the caution that I've raised before with the commission, but I think is so important that we take forward. As people start to electrify, they start to do fuel switching, they start to replace appliances. This is the biggest, unfortunate, and it's fortunate and cautionary. We will do more to disturb lead-based paint at the highest scale ever collectively in the country. So we all have to be prepared for that alignment of safe work practices, for preparation for that, for aligned lead dollars. This is going to cause us, I mean, the reason we're doing whole house is precisely around these issues. You can't, if you do one, you're going to trigger something another, and you can't do one without doing the other, meaning you got to take lead, asthma reduction, mold, mildew, and the weatherization, electrification side. So as people think about this, as the departments are having strategies around this, really important we pay attention to it. It may be something in the door-to-door campaign to be, if people are signing up for this, we got to make sure we get them a lead grant and do that alignment. So I'm so glad that Catherine, Nicole are weighing in on that as well. Any questions? Also, I should say, Latricia has joined the Thriving Communities Advisory Board for Region 3. So we're really glad that, along with so many others, that would that page is up so you can see the illustrious advisory board. Thank you for that. But any questions for Ms. Adams before we move on to the rest of the agenda? All right. Well, thank you. You're welcome to stick around. No, now we've got a lot of perfunctory stuff and it's great, but I know you're busy, but you're welcome to stay. So thank you very much. Wendy, let's go. Where are we here?
I got a meeting at 11.
Okay. All right. Thank you.
Probably need a nap.
We have some new business that we want to talk about, legislative outcomes. So Wes, did you want to, I know May 9th, we will sign the Empower Bill, which is really energy efficiency, but does pay attention as part of the whole house strategy for the state. But is there anything else from legislative, Wes, that you want to bring up?
I just will give the final resolution. So just a couple of bills real quick that were lead related. We discussed them last time, but they were passed. So House Bill 97 was the baby food, the toxic heavy metals bill was passed. The Renters' Rights and Stabilization Act, that was the governor and the administration DHCD's bill, would increase fees for court filings, but part of that funding will go to additional relocation assistance funding and housing choice voucher funding potentially at the department. So in a future meeting, we may want to have a DHCD talk about that opportunity. The Maryland Department of Environment registration fees bill passed the House, but did not pass the Senate. That would have increased annual registration fees from $30 to $120, but make the registration for the Maryland Reduction in Lead Risk and Housing Law every 2 years. So essentially an increase from $30 to $60. That bill did not pass.
Can we pause there? Is there any comment from the department as to what that does now that we did not get that bill passed? Any adjustments or anything that is it just keeping us from having additional staff?
Well, I think we're assessing the impacts. Obviously, really needed the revenue just for program operation and yeah, additional staff, particularly with the 3.5 and above.
It'd be good if we also could define exactly what that revenue was, so have that number in our head moving forward. Dr. Banks?
Yeah, we anticipated about $3 million that we were going to get over the course of 2 years. So we just had to, reevaluate how we do business and some of the plans we had about expanding staff. Specifically, the concern was that we estimate there's about 300,000 properties that are not in our registry that should be. So we've been working with SStat. Some of those funds were going to be used to put together that project and try to get that up and running. So, there's potential not only to have the registration fees increase, but also to increase the catalog of properties we have in the registry. So,
So Wes, as we contemplate the $20 million application on EPA, does it allow for support of government in this kind of manner, like would allow for expansion of inspection, and could there be a line item within that that could at least pick up some of this that the legislature didn't pick up?
I would expect there's funding. I mean, it definitely has governmental private sector partnerships, and so it's fairly flexible on what funds could be used for. But it would typically be like you said, an initiative that then is sustained maybe with state funding long term. But
yeah, I mean, it does have a part around community change to support initiatives that are looking at environmental justice and environmental health. And I think so we should go offline and talk about whether or not this could be incorporated, right? So some of what we're trying to do, because I know we're going to change this at DHCD, is the lack of lead and healthy housing funding for the broader footprint area, augmenting what we have to what our need is. And with the augment of the dollars coming in on greenhouse gas and solar, how much work we have to do in those houses. So thinking about all of that, but I'm just putting a pin in it. Can't make any promises on that, but we're looking at how we do this. It is a community-driven application. Latricia alluded to that. Government is a support in it, and you have support from cognizant agencies. We have support from Baltimore City and others. So really, if we can get a number on that, what the outcomes, what the impact would be, I think it could be evaluated in the contemplation of this to see whether it would fit, right? Because we want to be good supporters all the way around on that. Okay.
Thank you. Good.
And that includes things like relocation and different things, right? That need to be faster, quicker on that. Okay, so let's go to the next thing. Next year, we have to work to try to get that correct.
And then, there's two other bills. So the Just Community Designation Bill, that's a DHCD bill that would actually designate underserved, disproportionately affected communities by environmental health and other issues. And so that will concentrate funding and prioritize funding to those designated areas in the state. So that bill did pass. That was House Bill 241 and Senate Bill 308. And then the last one.
Hang on one second. Do you know if does that align with the Justice 40 out of EPA? Do you know what the alignment is?
Currently, our new Assistant Secretary of Just Communities is drawing on all available environmental justice data. The goal is to go down to the census tract level. So wherever that data is available, we'll be pulling from. I know she's met with MDE regarding their tools. I believe she's tried to reach out to EPA to understand their tools. I'm not exactly sure, where she is.
I can help you with that.
Yeah, that would be great. Well, that's what I just, was speaking to our guest about. So any connection would be great.
So we can help with getting that because they've got a pretty good tracker, right, that you can look at for the state of Maryland, but how they developed it. I think it does miss some of our far western areas and some of our lower eastern shore. So we've made a determination looking at where there's need that's not, where dollars aren't going, and there's clearly need. So looking at that, I'd also encourage you to talk to like the Chesapeake Bay Foundation because they're looking at this and others. But certainly that's good news. Okay, and the last one.
Last one was the phase out of lead ammunition for hunting purposes. Senate Bill 983, House Bill 1473 did not pass the legislature.
Okay, that defies logic. Okay, all gun owners need to think about this. Can poison them as well. All right, I want to just go on the record to say, Wendy, and I want to work with you and Stephanie and Fred and Paul and others. Got to get a letter to Secretary Edwards to move nominations for the commission. We really need to. So I'd like one coming from the commission to do that. I'd like to also coming from the commission, a letter to Senator Ferguson and a letter to Secretary or Speaker Jones. We have got to get the appointments through. We are failing the public not to have a full slate of appointments to the commission, and we need to address those things. So if we can, maybe Paul and whoever right here, just get together, have a quick phone call, go over the elements of that. And I would like to, by the end of next week, have those letters out the door and over to the governor's office, to the appropriate places. And so I'm saying it could be as much on what we need to be doing as them. So I'm not blaming anybody here, but we got to get moving. And I just think we've talked about that a long time. And what I had talked to Delegate Boyce, but I think she needs to get appointed by the speaker. And on the Senate side, I thought the Senate had recommended Senator Washington, but we just need to see what's going to materialize there. Just wanting to do that. Before we get to the local funding unit production update, also, Wes, under new business, you had you were going to put in the chat and describe the EPA RRP regulations and notifications from MHIC. We've continually invited MHIC to these meetings. We may have to get the governor to maybe create an appointment for them to get them to the table. But can you tell us what's going on here, and update? And I don't know if Chris White and Susan are here, know anything about what these are. Go ahead.
So we're just posting in the chat. The MHIC has 2 notifications on their website regarding the EPA RRP rule. So any renovators, home improvement commission licensed contractors, MHIC has 2 postings, one in the licensing section, notifying contractors they may be doing work that implicates the EPA RRP rule. And then they have a whole section called in their frequently asked questions for contractors on the lead paint rule as well. So they posted 2 sections about the EPA RRP rule to make contractors aware and put on notice. They also notify contractors at the time of licensing. They have put a blurb in their notification to pass for new licensees. And so those are just some updates. I know the commission was interested in still meeting with them. And then the other agenda item was the commission interested in working with local permitting offices, as has been done with Baltimore City THCD, Assistant Commissioner Jason Hessler. So that was the other aspect, was does the commission want to send a letter, get involved with the local permitting offices to see if they can also support EPA RRP rule compliance.
So Nicole Hart, I assume you heard that with regard to, is Nicole there, or Catherine?
She's on, but Nicole's muted.
Okay. Well, we'll follow up with Baltimore City and
Nicole's here.
Yep. So if you want to follow up on the localization of the enforcement of EPA RRP, we'd love to talk to you about that, especially for the Baltimore region. And we will, Wendy, if we could, again, ask MHIC to come next month, and maybe this will be a good hook for them to come and talk about what they're doing, how they're incorporating this in training. And I assume MDE will follow up on this, because our EPA RRP was always over here in the regulatory side, right?
Yeah, I mean, right.
So,
Yeah, we have to, it's interesting. We're going to see probably, I mean, I'm hoping that MHIC takes it to the next level, which requires the contractors to become or provide documentation. And then, if you put it in state statute, obviously it'll go over to locals.
Yep, absolutely. So that, I think we ought to figure out how that ought to come into a conversation to do that, and potentially into legislation if needed to do that in the requirement side, or whether it can be done on a regulatory basis. It'll help all of us to know, all contractors doing this work, right? There's going to be fast scaling on so many things in houses. So literally with hundreds of millions of dollars coming down to Maryland alone in the private market on home repair. Wes, so is that it for the legislative?
Yes, and then just one distinction there on the local effort is some of the conversation has been around if they won't require it for all permits, would they require it when windows are being replaced? So that was one thing that city was considering for Baltimore City, was that would trigger a requirement to verify that you have RRP rule certification if you're doing window replacement. Many jurisdictions require a permit to be pulled for window replacements. That's another consideration, is if they won't do it for all contractors doing permitting work, when you do pull a window permit, that could also trigger them to show proof that they are RRP rule certified.
Great. All right, barring any other questions, can we go to the next item on the agenda, please? All right, I can't see it, but I think we have a.
Yeah. Did Fred, did you want, like, you had slides? I didn't know if you wanted to do your slides, or that was already, like, is that something that you were still going to do?
I think Dr. Mitchell covered everything, unless you guys had specific questions about where MD was with stuff. I can answer them. So
just wanted to double check with that. And then I guess next up is the lead funding unit production for Baltimore City. That's what we got next up.
Yep, and let me just pause and say, please share the slides with the commissioners so that they can be seen. Dr. Mitchell?
Yeah, and I was just going to add one other thing to Fred's comments. I do want to let people know, because I don't think the commission is necessarily aware of it, that one of the windfalls that we got totally unexpectedly, which has really helped the local health departments and the state, is that in addition to the Medicaid CHIP home visiting program, which provides home visiting services for children in in the 11 jurisdictions that are probably most significantly affected by lead. In addition, we have, for the past 2 years, since 2022 actually, been able to provide supplemental funding, which does not exist in the state, for lead case management for the other 13 jurisdictions, which don't have any dedicated lead case management funding of any kind. That was as a result of funding from the Association of State and Territorial Health Officials, which they provided to 3 states, Arkansas, North Dakota, and Maryland. And we used that funding, about $1 million, to provide support to those 13 jurisdictions over the last 2 years, which just totally coincidentally happened to coincide with the 3.5 microgram per deciliter change in the blood lead reference value. That has allowed those jurisdictions, it's provided support to staff to be able to do that. And it is without that, they would have had to absorb those costs through other programs or other activities, or they would not have been able to do case management. So that I will just share with you that in 2023, from January 2023 to April 30th, just in that period of time, and I'm compiling the numbers with Akuya Botama for the last year, but 74 kids across the state were case managed by virtue in that 3-month period, actually 4-month period. 74 kids were in active case management who otherwise would have not been as actively case managed. And as Ruth Ann and Fred and some of you, the rest of you know, that has been extraordinarily important because there have been some extraordinarily complex and complicated cases to manage, which have taken multiple staff, multiple person hours over the past couple of years in order to manage. And that money, by the way, I don't expect that that money will be available to us after the end of the fiscal year, because I don't know that those funds are going to be renewed.
Really?
Correct.
All right. Something more to focus on, right?
Yeah.
Any other comments on that? Cliff, is there any thoughts around actions that can be taken and on that funding?
Well, as you know, Ruth-Ann, we receive approximately $1.3 million for lead case management to the department. And that money is used as the state match almost in its entirety for the lead and asthma home visiting program. Those are the only funds that are available for the lead and asthma home visiting program. We have been able to supplement those funds over the past several years with money for asthma that was part of the statewide integrated health improvement strategy funding from the Health Services Cost Review Commission based on fees from hospitals. That funding expires in state fiscal year 26. So currently our budget for home visiting programs for the 11 jurisdictions that are doing it is approximately, roughly $5 million, of which about $2 million is funding $1 million from the lead case management money, roughly, and $1 million from $1 million a year from the SIHIS funding. That SIHIS funding is due to expire in state fiscal year 26, which means if there's no other funding, that our funding for home visiting could potentially decrease by 50%.
Yeah, so I think we need to set up a meeting, map that out, and map out other places that we can get some money on that, both in the interim and the long term, right? And as the governor's office is building out the Enough Act, right? Some of that he focused on lead. So we need to look at whether there's some leverage off of the Enough Act that I think came out with $13 or $15 million in funding. But there were specific references around lead. Now, how that's intended to be used, I don't know. But we ought to build some way to leverage that. So I think we need to kind of do an asset gap analysis, a mini one on funding here, and start to really hone in on the ways we're going to look at how we're going to get funded in terms of the activities for the state on this moving forward. So I would say get past the asthma summit. I'm going to ask Wes Stewart to convene folks to talk about this, see if we can help think about that, both state agency, philanthropy, potential federal grants that could help supplant some of this. So best and see what we can do there. That makes sense. Thanks for delivering the good news there, Cliff. Always the best.
That's my job.
There you go. On the next thing on the agenda is Baltimore City. I don't know if Baltimore has a update, Catherine and Nicole, on where you are on lead funding, unit production, and where the sort of balances on that or numbers. That'd be great.
Did you want to share your screen, or do you want me to go ahead and do the presentation for you?
Can you share your screen?
Yep, I can do that.
Thank you.
Pull it up.
Good morning, everybody, by the way.
Good morning.
So we wanted to give you guys a update on how things are going with our lead grants. You can go to the next slide, Wendy. Again, these grants, the purpose of these grants is really to reduce lead-based paint hazards in Baltimore City. Those that qualify include a child under 6, being in the house, visiting the house, or a pregnant woman. Our goal is to educate the community on these hazards and about lead poisoning. And we also work in properties that have owner-occupied and tenant-occupied units. You could go to the next slide. So far we have completed in total 378 units in regards to lead inspection and assessments. This has been going on since 2021, and we have completed and cleared 95 units. Next quarter, we are expecting at least 22 units to be done, and that number is swiftly changing as the days go by, depending on settlement meetings. For our first grant, this is the lead abatement grant. That has been around since 2019, right in the heart of the pandemic, as well as the second one. As you see, these numbers are older grant has completed at least 63 units so far. And these numbers are up to date as of last week. And our Healthy Homes Impact grant has completed 32 units so far. You can go to the next slide, Wendy. So I wanted to show you guys some of the pictures of some of the work that we have completed so far. On this picture to the left, you see the before picture. This shows deteriorated paint, lead paint, that was found at one of our constituents' homes. We were able to repaint the entire front of the house and the side of the home. And the next picture, you'll see about some stairs. Wendy, if you can go to the next one. We were able to repaint this lady's back staircase porch. This also came up positive for lead. Not only the porch floor, but also the stairs and railings. The next one, the next slide, you'll also see another stairs in the basement. To the left top is the before picture of deteriorated lead paint that we found. We were able to scrape and paint and repaint it black. And onto the right is stairs descending from the first floor into the basement. The treads and risers. We also were able to stabilize the wall of the whole basement in this home where we found deteriorated paint. And you can go to the next slide. So our 2 grants each were awarded funds from Housing and Urban Development. Our first one was for $4.1 million. So far for lead remediation, we have spent nearly $260,000. These grants also include Healthy Home Supplement funding, where we can address other housing issues that we find that may be a priority for the homeowner, such as electricity, roof issues, heating issues. And we spent about $90K for our first grant. Our second grant, which is the High Impact Neighborhoods Grant, is up for $9.7 million is what we were awarded. And we were able to spend up to $162,000 in change in lead remediations, and in Healthy Home Supplement money, we were able to spend up to $56,000. We do have still remaining balance on both of these grants. Our first one did close as of March 15, 2024. The grant period was for 5 years. And our second grant will be ending next year in May with a balance of about $8.5 million. So still a lot of money to be spent, and we are hoping that we can spend as much as possible. The next slide, please. So With ARPA funding being available for DHCD in Baltimore City, we have been able to utilize this funding to help offset extra lead work that we find at homes. Especially, we've noticed for these years since the pandemic, there has been an increase of other housing issues going on in the homes. And a lot of these housing issues can offset our ability to do lead work. So we have been using ARPA funding like crazy. As you can see, we spent up to $434,000 to help with healthy homes issues. And we have so far started looking into utilizing the ARPA impact investment area, which are certain pockets in the city to help with housing hazards as well, which can also include lead work. DHCD has also been providing matching funds for lead remediation, and we have spent up to $800,000 towards lead work as well. Next slide, please. So some of the challenges that we have faced during this period of the grants, both grants, is obviously the pandemic. These grants were not prepared for a halt in unit production, which was resumed in March of 2022. During that time, there was numerous staff turnovers, a distrust from the community of having people from the public in their homes, which is what we need to actually assess what's going on in the home. We've had some issues with our procurement, with our contractors. So we do have about 7 contractors that we are working with on an emergency contract. And of course, the increased cost of actual production. Since the pandemic, we've noticed an increase in materials and the amount of work that needs to be done. But luckily, we have been able to use ARPA and other DHCD funding to help offset those issues. So some of the solutions that have come from our challenges is that we were able to use this emergency contract, although the RFQ has not been finalized. Another solution is that we were able to actually expand our 2019 jurisdiction area. The high impact neighborhood grants are actually meant for only 4 census tracts in a given city. We were able to expand it at the beginning of this grant, and now we were able to expand it to Baltimore citywide, which I'll cover in the next slide. So far, we have been working with our partnership with the health department, and we've received numerous referrals from them for elevated blood levels, and 606 to be exact. We've also expedited the hiring process. So we are nearly fully staffed, which is great. And they work every day to try to get us to our goal for this program. We've also began utilizing online portals to receive applications such as Neighborly. That's where DHCD is able to give information to clients on all of their numerous programs, and this also includes the LED program. So we are accepting applications online. So far, we have also increased our outreach efforts. We've hosted numerous door knocking events. We've attended at least 45 community events so far, and we've hosted numerous of power presentations to stakeholders and local community organizations. And we've also been utilizing the Mayor's Office of Immigrant Affairs to reach out to those communities that are not proficient in English. So they've been really helpful in getting our information translated and actually getting a chance to meet with those organizations to kind of build the trust between our organization and theirs. And next slide, please. So one of the solutions for the high impact neighborhood grant is we've realized that in the original areas that this grant was covering, was our most difficult to actually get enrollment into the program. Many of these clients would want to enroll in the program, but a lot of them may work multiple jobs. We deal with a lot of renters in the situation where it's not the renter's choice to be in the program. It's really up to the homeowner, who may or may not live in Baltimore City. And a lot of these clients also have issues with being able to relocate, or they do not trust that if they are involved in this program that they won't be evicted. So those were some of the challenges we've come across with that 2019 area. So in order to make sure everyone has access, especially since we are working on one grant currently, we have asked our funders, HUD, to expand the high impact neighborhood to Baltimore citywide, which they did approve, which is great news. So we have been reaching back out to a lot of our clients that were enrolled in our initial grant and trying to enroll them. And so far, I think we've actually closed on 3 of them that did not make it to that deadline. So we're hoping to get a huge increase and really see a higher number by next quarter of completed cases.
Catherine, does the high impact grant have a higher threshold of money per unit?
Yes, it does. And recently HUD also announced that they will be increasing that unit for lead work to $30K per house. And for healthy home supplement money, it will now be $10K.
So you could have a home for $40,000, which would start to really materially change for Baltimore the actual cost of doing this work.
Correct.
And Catherine, I cannot appreciate more your presentation today, the work you're trying to do to get past just the bureaucracies of things coming out of COVID. And I don't even mean government bureaucracies, but I mean just the all workplace bureaucracies across the landscape here. Did you have a question?
I do.
Cliff, in a second, Barbara had her hand up first.
Okay, so I'm not sure if I understood the slide that you had regarding the money that's unused.
Right.
So the one grant of 4.1 million, the other 8.5 million, but the date for the first one ended March of 2024. Is that money lost or still available to be used?
So that money is still available to be used to a certain extent. We are able to spend down on that money all the way up until July of this year.
Did we ask for an extension?
We have received an extension already. So this grant was initially supposed to be ended in 2023. We got the extension to this year, and HUD only allows up to 5 years of the life of the grant. So right now we are completing the remaining of cases that we have. We still have some units that we need to complete, as well as post-remediation work that needs to be done. This grant also funds salaries and our partnerships with the health departments and the other sub-grantees that we have. So we do still have the opportunity to spend down on that money.
Catherine, can we enroll new units in that money?
No, we cannot, but they can be enrolled into the second grant, which is that high impact.
Is HUD precluded from doing this statutorily, or can we potentially petition them?
Well, HUD has been quite understanding of the situation because a lot of lead grants throughout the nation have suffered. Specifically, Baltimore City has had a hard time because of the 2 years that we lost. We can't really get those years back without unit production actually have been done. So they have been understanding, and they're hoping that now that we have this one grant to work with, that there would be an increase. We're not expecting a huge impact moving forward because we do want to apply for another grant. But I did meet with Yolanda Brown in Minneapolis, and they have been quite understanding of the situation.
So the city will not be downgraded because of they're going to basically make a COVID exception on this?
That's what I've heard.
This is something I think really important, and that I'd like to talk to you more, but if the commission could send a letter or the state could send a letter or whatever in support to extend this extension. But I want us to look statutorily to see if they can give a second extension on this, because that's $12 million of money, right?
4.1 that ended, and then 8.5 that ends next year.
8.5 in, so we'll, right. Of the 8.5, could you at least send to me, and then certainly to those working around the Baltimore here, just kind of after you get past administrative dollars out of that 8 million, what you have, what I'm looking for is an estimated number of units that if we just hit the ground, just helping the city enroll, what's the number we need to hit? That's often very helpful to just know we got to hit X number of families, right, for enrollment, and make that a collective effort so we don't lose the 8 million, right?
Right, right.
How many do we have to enroll by when? Whatever that number is, could you send that to me?
I sure can.
We can make that a campaign effectively, right? And do that.
Yeah,
Okay.
we are expecting about, from the ones that we've completed so far, the unit number is between 300 to 400 units that can get done. That's about $1.5 million.
Okay.
Well, no, it's about 2.
So we need to enroll 300 families in Baltimore City. If that's the number, then that's the number. We can divide that by neighborhoods with city council districts and start to go after it.
Right. And now that we've expanded again, we can include almost any district at this point.
Yeah, I mean, I think we'll exempt Guilford, Roland Park, Mount Washington potentially, but otherwise do that. Follow-up question?
Yeah, just to clarify. So you're saying it's approximately 1.5 million to take care of 300 to 400 units?
I corrected myself. It's about 2.5.
2.5 for 300 to 400
units. Yes, for lead remediation interventions. And then there's about 500K towards healthy homes.
Didn't matter.
Yeah.
So Catherine, wait, let me just go back. We have 8 million left for about a year, right?
Mm-hmm.
So what is the 2.5 million that you're referencing? Is that after you take the ones that you have in the queue?
The 2.5 I'm referencing is strictly to pay contractors to do lead remediation work.
Okay.
And 300, 400.
And you're getting 300 units out of that?
Correct. That's the goal that HUD has set.
So by my math, that's $8,333 per unit.
Yeah, that seems low.
That's just too low.
Yeah.
So this is why we've been utilizing a lot of ARPA funding and our Healthy Homes money. DHCD has been able to provide us with a lot of help, and we do have obligated matching funds that DHCD provides for lead interventions as well.
How much ARPA money, Catherine, do you have left? And I'm just trying, what I'm offering to do is with GHHI, want to look at our ARPA money, our congressional funds, the money you have, and see if we can't come up with a plan of action around the units, right, that get to the threshold that we actually need on cost. I'm not talking about our HUD money because you can't match HUD money and HUD money, right?
Right.
But I'm talking about what do we have that we can help you, at least at GHHI, state may have other, and why don't we have I'll invite you over for some decent sandwiches, they're not going to be gourmet, but basically tuna or turkey, or mozzarella, and let's sit down and let's map this out, and then let's just deploy people in to do this. Dr. Mitchell.
So I have a question that's related and comes out of this, and I'm trying to understand a little bit. Is there an ongoing meeting, or is there ever a meeting between Baltimore County DHCD, Baltimore City DHCD, and Maryland DHCD on lead-related housing programs as a whole? Do you guys meet regularly with your sister agencies?
Not with Baltimore County, but I have met with Frederick a few times.
So I at the risk of intruding way over the line, putting my foot into another agency, but because of the Medicaid CHIP program for housing, which also operates in this space, and given the importance of what you are doing, and the fact that $8,000 sounds very low, and the fact that there are multiple agencies involved, and I always worry about sort of competition rather than cooperation in this effort to try to help everybody and lift all the boats, as it were. I'm wondering whether it would make sense to have a meeting of the agencies that are all involved in housing and lead, particularly in Baltimore Metro region, including us at the health department because of the Medicaid CHIP part of this, to talk about a sort of a more comprehensive strategy that would essentially help you and help the other agencies, because all of them are trying to recruit for this activity, and there's certainly more than enough need, but it makes sense to me to try to have a one-stop blanket. If you have lead and you have a home, you have help, and then we can steer it amongst all of those agencies, and in fact do a more comprehensive view at enrollment. It has worried me for a while, I guess, that I wasn't sure how much cooperation there was amongst the agencies to try to do this on an efficient basis. And again, this is not my bailiwick, and I always worry about stepping into housing, but I will say, just as a commission member, it feels like there's a huge opportunity for the agencies to work together, not just with GHHI, but with each other and with us, to try to do a one campaign for lead-related housing.
Well, Cliff, don't get me wrong. That's what I'm suggesting.
Okay, so Ruth Ann, I just wanted to get all the agencies who were doing this in the same space.
Exactly. No, that's what I'm suggesting. What I'm looking at is who has money. So I'm looking to my right and I'm looking on the screen for housing, right?
Yeah.
MDH doesn't really have housing money per se, right?
Well, except that the Medicaid program is.
Well, that's true. Right. Sorry, I'm thinking that's getting executed through DHCD. Apologies for that, right? You're right. So 100%, and then whatever MDE wants to throw in there. But 1,000%, what's all the money we have, and how much and how fast can we get this family set? I'm a full agreement. So don't misunderstand that attempt to try to get this money used, right?
Right.
Dr. Mitchell, were you finished?
Oh yeah, no, I just wanted to make sure that we were thinking about all of the housing programs, not just the Baltimore City housing program.
1,000%. Very good point. Very, very good point. And that should include any other counties too. All right. Catherine, do you have other questions for Catherine, or does Catherine have other things?
No, I just have on the next slide my contact information and Nicole's information. If you guys do want to reach out and help out or even meet, this is our number and our emails as well.
Okay. Well, that's great. Thank you so much. And I will I'll ask Kennedy on our staff to Dr. Mitchell for DHCD, for the city, for anybody who wants to come together to that kind of, let's figure out a mapping on that. Let's see what we can do. And we'll do it after the 7th of May, but relatively soon if everybody wants to do that. It should be, Wendy, in the chat, there should have been a link. If it'll be coming if it's not there, but should have been a link for the introduction of the Lead Safe Housing for Kids Act federally as well. I just wanted to go over. This is being introduced by Dick Durbin out of Illinois and supported across the country. And this is for children in public housing that if it passes, would prohibit the use of visual inspections for low-income housing constructed in 1978, require the use of risk assessments and a more accurate evaluation tool for lead hazards in public housing. It would get away from the HQS standard when looking for lead, long overdue, right? And would bring equivalency for children living in public housing to the standards that we require in private housing through the HUD grants and through state law in Maryland. It would also provide a process for families for relocation on emergency basis and would end the practice of families losing their place in line for public housing assistance if they had to be relocated, which has been a real equity issue around this. If an owner fails to correct a hazard within 30 days, there would be a relocation, and it would require landlords to disclose the presence of lead, taking away any exemptions on the disclosure rule, and bringing, again, equivalency in for public housing. Too often, we take for granted that kids in public housing are getting the same rights, the same treatment, rational basis. I will remind folks that it was only 3 or 4 years ago that the U.S. government mandated that there be carbon monoxide detectors in public housing through the United States where there are gas appliances. And some smartly did that, not all did it. And these are the things that we have to pay quite attention to, because the damage done to any child is a cost that they and we will pay for the course of their life. Wendy, where are we on our agenda?
So where we are is at agency hot topics, and I will go ahead and share the screen. There we go, MDE right here.
Thank you. I don't have anything. Stephanie, do you have anything? Fred?
I don't.
Okay, Dr. Mitchell, anything else?
Nope, I think I've covered everything.
Dr. Rogers? Okay, I'm gonna stay with the flow. Dr. Paul? No. Angela?
Thank you, Ms. Ruthan. I met the Office of Child Care leadership team met with MDE, Mr. Banks and his colleagues to discuss the funding for water service line testing and replacement for lead. We met with them last week, and they requested us to give them the addresses so that they will be able to locate the locations with the public water or the well water source. And we would have the continued conversation to figure out how we can implement this project, exciting project.
Fantastic. All good on that. And thank you for that. Thank you, MDE. On the water side, MIA?
No, nothing. Thank you.
Okay, the HCD?
Yeah, so we have a few updates, or a couple updates. DHCD recently got a new director of building and energy and housing programs, something along those lines, pretty much the whole home approach. It's actually the former director of the energy programs, Nicola Tran. So she's taking over. And now that we have that person in place, the department is focusing more on, the traditional whole home approach. So that's being done both in terms of looking at how are we identifying energy upgrades for properties that receive critical repair funding and vice versa.
Can I pause there?
Sure.
Has the state staff been trained in comprehensive assessment?
I am not sure. Jack, are you on the line?
I am on the line for the traditional energy audits. Those are outsourced with our contractual. We do have inspectors from the critical repair standpoint. I do believe that many of our inspectors in the energy department, which is not my department, I apologize, do have the equipment and at times but go, I believe when they go to the site, it's more of a quality control to make sure that those are being completed correctly, but they do have the material the resources to conduct audits. But many of the programs, those audits are conducted once an application comes in or is referred over to us. They check from a programmatic eligibility standpoint, and then it's assigned to a vendor who then conducts the audit to advise what they are eligible for under the particular funding source.
So Jack, that's not exactly my question. What I'm getting at is I'm going to encourage and urge Deputy Tran and the team to get a training in what comprehensive assessment looks like when you're looking at all of those environmental health impacts in housing that need to align together, and to bring your vendors in and have them trained on that comprehensive assessment look. Otherwise, they're not really taking a whole house approach in sort of a more efficient way. It will make the work you do over time so much better. It will actually accomplish what the recommendations are from the Green and Healthy Homes Task Force at the DHCD. I don't think it's going to be a difficult thing to do, but if for states that are doing a whole house approach, they are doing this fundamental training, I'm happy to help you think about that or do that, but you want to make sure that those energy auditors are really attuned to how to see lead, attuned to how to see mold, mildew, moisture, attuned to how to think about trip and fall prevention or other moisture intrusion, and be thinking about that holistically so you can do that up front. So I'm just giving you some unsolicited opinion on that.
I'll ask the question.
Okay, there you go.
So, to the end of trying to blend these programs, currently we're taking the properties that have received the critical repair services and referring them to the energy side of the house to assess them for weatherization upgrades. Additionally, on the other way, the department has committed $4 million in grant funding to work with 6 different counties in the state that are also local weatherization agencies, so that, as you may or may not be aware, when a house is assessed for weatherization, some of them can be deferred due to existing issues. One of those frequently is lead. So in order to ensure that those properties that have been identified as having an issue, again, that could be lead, mold, some other critical repair, those local weatherization agencies, which also happen to be the housing departments for these given jurisdictions, will be reaching out to those individuals to provide a warm handoff between those agencies and state DHCD. State DHCD will then be reaching out to them to hopefully get them enrolled in our critical repair program to address those underlying issues. And then once those underlying issues are addressed, then they can move back to the weatherization component of this. Of those 6 jurisdictions, we have executed MOUs with 4 of them, and then obviously 2 are still outstanding. Lastly, you had asked about the HUD debrief. HUD has reached out to say that they are aware of requests for debrief, but haven't scheduled debriefs with anyone yet, and will be in touch at some point indeterminate in the future to schedule those debriefs.
Yeah, I would encourage them quickly because they're going to re-release, and Barbara and I are going to be providing coffee for you guys to get those grants, right? Yeah, absolutely. Yeah. So I want all the help in the world on that. Thank you so much. Thank you, Jack, as well. All right. I think Catherine and Nicole, you did a great job. So we're unless you have something else you wish to share.
I do.
Okay. Yes, ma'am.
Really quick. So here at DHCD, in my division, we have what's called the Emergency Mortgage and Homeowner Assistance Program. And just to make everybody aware, because we look at our constituents holistically, what that program assists with is mortgage assistance, taxes, assistance with taxes, assistance with water. And we've been doing this as a post-COVID response. It's federal CV money that we're spending for this effort. And I just wanted to lift up that we were able to do an amendment. So now we can help with more than $5,000 worth of assistance. And we've expanded to up to 120% AMI. And we can help renters with water bills. So if you all have any referrals you all need to send our way, the application is linked directly off of our website.
That is wonderful. And if you provide that to Wendy, it'll go out in our package as well. Okay.
Absolutely. We are in the process of updating our outreach materials to be able to change it to that information.
Fantastic. And Nicole, you know, for anything we do with you, make sure we have it. I think we've given a lot of updates on a number of things today. I'm just going to encourage folks to sign up for the Eventbrite for the asthma summit that the state health department is doing an amazing and fabulous job on, and really thank them for continuing this. We have Dr. Gray from WellPoint as a keynote, who is worth tuning in for or being there for. And I know for those who are at the event, we've got a number of free tickets afterwards to the Bowie Bay Sox if anybody wants to take advantage of going to a Bay Sox game. So you want to breathe easy and then cheer for the Bay Sox. It's all good. The Yankees are in town, so beating the Yankees is a matter of law in the state of Maryland.
Is that the game last night? Did it go well?
Yeah, well, you're not allowed to go to any more.
For 2 and 3, right?
Yeah, good point.
But and we will end here next month. We have invited Dr. Jacoby Wilson to give a presentation on the EPA Technical Assistance Center. So that's part of a 3-pronged approach under Thriving Communities, and Maryland and the University of Maryland National Wildlife Fund head up the region's Technical Assistance Center to help groups prepare to write grants and access funding from the federal government. And commissioner membership updates and renewals are due in September. Wendy will reach out to you on that. We thank you. Have a great day. A question from Dr. Mitchell.
No, just probably I should help Wendy out by reminding people who haven't done their ethics submissions to just remember to do your ethics submissions.
I got to call them. I tried to do mine 2 or 3 times and it won't let me list the lead commission. So it limits the number of commissions or boards or something.
Yeah.
So the only thing up there is the Green and Healthy Homes Task Force and on 2 other boards. So I need tech assistance.
There should be, I think the last option should be where anything additional. And so you might be able to stick it there.
Just stick it in there.
Yeah.
Okay.
We didn't hear from the Baltimore City Health Department from Julie.
Julie, I apologize. I did not mean to skip you at all. Come on up there, Fred.
Hello, no worries at all. I just put into the chat just a reminder that on May 17th, the Greater Baltimore Asthma Alliance is having a meeting. They will be going over any of the 2024 legislative session. So anything that, any updates related to asthma. So just wanted to share.
And they are great partners in the State Asthma Summit, and really appreciate, Julie, your work, Margaret's work, and the health department on that. Thank you so much. And thank you, Wendy, for that. Julie, I apologize. All right. Hearing nothing else, we're going to say, go Orioles, beat the damn Yankees, and we close the meeting.
Thank you.
Thank you.